Chronic fatigue syndrome, myalgic encephalomyelitis, is an umbrella term which describes different types and severities of fatigue. The CFS ME service is dedicated to its diagnosis, assessment and treatment, and supporting you with the self-care and management of your condition. We are guided by the National Institute for Health and Care Excellence guidelines and tailor our services to your needs. Our clinical team consists of occupational therapists and GPs who have a specialist interest in chronic fatigue syndrome. Our administrator is there to support and guide you through our service. We recognise that your symptoms can fluctuate and will impact on your daily life, and our aim is to work with you to slowly and carefully unpick the complexities of your circumstances. Our service aims to increase your understanding and enable you to learn new skills and build on existing ones. So, how can you benefit from our service? Firstly, your GP will need to refer you to us. They will tell us about your past medical history and recent blood tests or assessments that you may have had. We may access your medical notes, but please be assured that all information is confidential and will only be seen by the team. If at assessment it is not yet clear whether you have CFS ME, you may be invited to discuss this further, either with your GP or our specialist GP. Following the assessment, the aim is for you to have an action plan, which may include group and individual therapeutic services covering graded activity, lifestyle and energy management, techniques for stress, anxiety and sleep management, such as relaxation, graded movement, stretching and exercise, advice on a healthy, balanced diet, mindfulness and cognitive behavioural therapy. We may also provide some advice and guidance at this time or signpost you to other professionals who we feel will provide you with helpful guidance. For most patients, the first introduction to our service will be an invite for you and a friend or relative to attend a self-management seminar. Our seminars cover a variety of topics, including defining chronic fatigue syndrome, the patient experience, what our service offers, and how you can manage your condition. The aim of our service is to support and guide you towards recovery or improved quality of life. At the seminars, we will give you a treatment pack, which includes an introduction to what is CFS-ME, an overview of our treatment approaches, a workbook, and a relaxation CD. This is the first stage of your self-management journey. Following the seminar, if and when you feel it's needed, you can book in for an appointment with a specialist therapist to assess your needs and decide on the next steps for you as an individual. Prior to the assessment, it is advised that you have completed the workbook and activity diary where possible. On booking your appointment, you will be sent some paperwork to be completed to bring to the assessment. This will enable the therapist to make a full and more helpful assessment of your needs. If your condition is particularly severe or complex, or you are struggling to manage, we can also assess your needs and provide recommendations on an individual basis. These are often more related to the home environment, energy conservation and carer support. We also support, train and consult with other professionals or carers involved in your daily life. We look forward to meeting you and working together to help you to live successfully with chronic fatigue syndrome and move forward towards recovery or an improved quality of life.